In this video by Deckplate, we will be discussing presumptive conditions, some of the most common presumptive conditions experienced by military personnel. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Presumptive conditions in Gulf War veterans. Presumptive service-connection means that the VA acknowledges that a condition is service-connected even without direct evidence showing that it was incurred during military service. What is Gulf War syndrome? Nearly 1 in 4 veterans who served in the 1991 Gulf War during Desert Shield and Desert Storm experience chronic illness. That's about 250,000 veterans. Even though the Gulf War was over 30 years ago, nearly 25% of those who served suffer from challenges related to their service there. In addition, veterans continue to deploy to the region today, and even now many of them experience new symptoms as a result of their service. While the exact causes of Gulf War syndrome are unknown, veterans who served during the Gulf War were exposed to many different environmental hazards in Southwest Asia. That exposure isn't limited to veterans during the Gulf War. Veterans deployed to the region since are still experiencing similar illnesses. In particular, there are suspected links between Gulf War illness and oil well fires, pollution, pesticides, depleted uranium, experimental vaccinations, and anti-nerve gas tablets. Gulf War syndrome. After the Gulf War, many Gulf War vets began developing seemingly random, unconnected chronic symptoms that do not comprise a single identifiable diagnosis. Because of this, the term Gulf War syndrome was coined to mean a group of unrelated, but disabling, symptoms that many Persian Gulf veterans developed after serving in Southwest Asia. If a clinical diagnosis can be made, then the symptoms do not constitute Gulf War syndrome. To be included under the heading of Gulf War syndrome, each symptom must be present or reoccurring for at least 6 months, chronic, and cannot be tied to service outside Southwest Asia or be caused by the vet's misconduct. Gulf War syndrome symptoms can include fatigue, skin symptoms, headaches, muscle pain, joint pain, neurological symptoms, mental symptoms, respiratory symptoms, trouble sleeping, cardiovascular symptoms, abnormal weight loss, menstrual disorders, gastrointestinal symptoms. Signs or symptoms which may be manifestations of undiagnosed illness or medically unexplained chronic multisymptom illness include, but are not limited to, fatigue, signs or symptoms involving skin, headache, muscle pain, joint pain, neurological signs or symptoms, neuropsychological signs or symptoms involving the respiratory system, upper or lower, sleep disturbances, gastrointestinal signs or symptoms, cardiovascular signs or symptoms, abnormal weight loss, menstrual disorders. The conditions listed below must have been manifest to a degree of 10% or more within 1 year from the date of military separation. Malaria must have become manifest to a degree of 10% or more within 1 year from the date of separation, or at the time when standard or accepted treatises indicate that the incubation period commenced during a qualifying period of service. There is no time limit for visceral leishmaniasis to have become manifest to a degree of 10% or more. There is no time limit for Mycobacterium tuberculosis to have become manifest to a degree of 10% or more. Brucellosis, a bacterial disease with symptoms such as profuse sweating and joint and muscle pain. The illness may be chronic and persist for years. Long-term health effects potentially associated with this infectious disease are arthritis, cardiovascular, nervous, and respiratory system infections, chronic meningitis, and meningoencephalitis, deafness, demyelinating meningovascular syndromes, episcleritis, fatigue, inattention, amnesia, and depression, Guillain-Barré syndrome, hepatic abnormalities, including granulomatous hepatitis, multifocal choroiditis, myelitis radiculoneuritis, nummular keratitis, capillodermatitis, optic neuritis, orchioepididymitis and infections of the genitourinary system, sensorineural hearing loss, spondylitis, uveitis, Campylobacter jejuni, a disease with symptoms such as abdominal pain, diarrhea and fever, Long-term health effects potentially associated with this infectious disease are Guillain-Barré syndrome, if manifest within 2 months of the infection; reactive arthritis, if manifest within 3 months of the infection; uveitis, if manifest within 1 month of the infection; Coxiella burnetii, Q fever, a bacterial disease with symptoms such as fever, severe headache, and gastrointestinal problems such as nausea and diarrhea. In chronic cases, the illness may cause inflammation of the heart. Long-term health effects potentially associated with this infectious disease are chronic hepatitis, endocarditis, osteomyelitis, post-Q fever chronic fatigue syndrome, vascular infection, malaria, an infectious disease caused by a parasite. Symptoms include chills, fever, and sweats. Long-term health effects potentially associated with this infectious disease are demyelinating polyneuropathy, Guillain-Barré syndrome, hematologic manifestations, particularly anemia after falciparum malaria and splenic, rupture after vivax malaria, immune complex glomerulonephritis, neurologic disease, neuropsychiatric disease, or both, ophthalmologic manifestations, particularly retinal hemorrhage and scarring, Plasmodium falciparum, Plasmodium malariae, Plasmodium ovale, Plasmodium vivax, renal disease, especially nephrotic syndrome, Mycobacterium tuberculosis, an illness that primarily affects the lungs and causes symptoms such as chest pain, persistent cough, sometimes bloody, weight loss, and fever. Long-term health effects potentially associated with this infectious disease are active tuberculosis, long-term adverse health outcomes due to irreversible tissue damage from severe forms of pulmonary and extrapulmonary tuberculosis and active tuberculosis, non-typhoid salmonella, a condition characterized by symptoms such as nausea, vomiting, and diarrhea. Long-term health effects potentially associated with this infectious disease are reactive arthritis if manifest within 3 months of the infection, Shigella, a condition characterized by symptoms such as fever, diarrhea. Long-term health effects potentially associated with this infectious disease are hemolytic uremic syndrome if manifest within 1 month of the infection, reactive arthritis if manifest within 3 months of the infection, visceral leishmaniasis, a parasitic disease characterized by symptoms such as fever, weight loss, enlargement of the spleen and liver, and anemia. The condition may be fatal if left untreated. Long-term health effects potentially associated with this infectious disease are delayed presentation of the acute clinical syndrome, post-Kala-Azar dermal leishmaniasis if manifest within 2 years of the infection, reactivation of visceral leishmaniasis in the context of future immunosuppression, West Nile virus, a disease spread by mosquitoes characterized by symptoms such as fever, headache, muscle pain or weakness, nausea, and vomiting. Symptoms may range from mild to severe. Long-term health effects potentially associated with this infectious disease are variable physical, functional, or cognitive disability. Thank you for watching our video. Please don't forget to subscribe and like our videos.